You're watching France 24. Hello, Michel, Sidibé. Thank you for being with us.
How are you?
It's World AIDS Day, and we've had this announcement made here in this country by the health minister. They're calling them in French auto tests, home testing kits, that'll be available over the counter as of the 1st of July of next year. Good idea?
Very good idea, because our last report has been showing clearly that one of our main problems was to make sure that people could know their status. 19 million people out of 35 million people don't know their status today. And you cannot control any infectious disease without making sure people are having access to testing. So testing should be probably part of our routine exercise. Testing should be convivial. We should go to family, community. So having a testing tools which will be convivial is wonderful.
I was going to say, because it is a bit of a brave decision, isn't it, to go and test yourself for HIV. Is it something that should be done alone, or is it something that perhaps you should do with people around you who can counsel you if the news is bad?
That is the beauty, because 30 years back, it was terrible. Knowing your status was a sentence, a death sentence for you. And stigma, discrimination, exclusion were attached to this HIV epidemic. So people were scared to know their status. People were not at all keen, because also knowing your status without having access to treatment. So today, I think it will be very important to go to community, to make sure that families can know, and you can be individually also trying to have your own test.
Culturally, would you say it's easier in some places than others?
Yes. I think it's easier because, for example, when you're in the countries like developed world, and where you have less stigma, less discrimination, and people are more educated, people are having access to information, it's easier. But when you're in even Middle East today or some part of Africa, still complicated because people are scared.
You mentioned the Middle East. I read, preparing for this, that it's where the highest number of cases is increasing.
Yes, it is Middle East and Eastern Europe and Central Asia.
Why is that?
I think you have many issues there. First, in Middle East, I think the taboo. We need also, you have all cultural background, all the debate around sexuality is not easy, and the position of women in the society. So it's very important to make sure that we are capable to support the transformation I am seeing today, because for the first time we are seeing the countries of Middle East, particularly the Arab League, coming together and proposing a new strategy, and strategy which will deal with stigma, discrimination. I was in Algiers just a few weeks back, where I had a big meeting with all the women groups coming from different parts. That was the first time we had the possibility to discuss about sexuality and how to equip young people.
All right, so breaking the silence in some very conservative societies. However, we're seeing that in other places, there are steps backwards, Uganda most notably, with this law in the past year. Part of that anti-gay law bill is it makes it legal for doctors to disclose their patients' HIV status to partners and families without a patient's consent. Your thoughts on that?
So I think that is certainly one of the part of our journey. We will have to really work together is the most difficult part, because today we are seeing that most of the countries with homophobic laws, countries who have been excluding people because they are injecting drugs, like in Eastern Europe, Uganda. You are talking about Uganda. I have a good news also to share today, because just 2 days back, a nurse who have been just put in jail or being pursued because she was part of, considered that she was transmitting HIV, has been released. So we are trying to make sure that we continue to reduce stigma, discrimination, and also particularly not leaving those people behind.
Uganda was a success story, was it not? At one point, they had, 18.5% HIV rate, which was huge.
Yes.
And now it went down to single digits. With this new bill, do you fear it's going to go back up again?
Yes, I think we have to really consider that any bill which will discriminate people, which will exclude people for having access to services, we should not accept it. Because I personally believe that what is important is the right of people to have access to health, to have access to social services. When we don't do that, what is happening is like in different places, people are hiding themselves. We are seeing that in Eastern Europe, in Central Asia, where people who inject the drugs are just going underground and they don't have access. So to give you one good example, sex worker. It's a very important group. And today you have many of them hiding condoms because when they are just arrested with 3 condoms, they're considered as criminal. And we know with data that sex workers are 13 times more likely to be HIV positive than groups of people who are not sex workers.
Now, there's been huge outcry, of course, over this bill in Uganda. Do you feel like you're getting through to President Museveni?
Oh, yes, I talked with President Museveni. I already I sent many letters to him. And because of the advocacy and the work I did with the President of General Assembly, we have been able to make sure that we secure that.
Has he written back?
No, yeah, I think we had a one-to-one discussion.
Okay.
And I think what we are continuing to do is to make sure that we are not ending with a reactionary approach, making people understand that it is the right of people to have access to life-saving medicine, that we should not deny anyone from this right. And we are progressing. Believe me, we are progressing, is listening, and it is not an easy task because it's not only in Uganda. We have almost 79 countries with homophobic laws, and it is a huge problem for all of us. But I'm happy to be also back in Paris because the movement started here just 20 years back.
Michel Sidibé, as you said at the outset of this conversation, AIDS used to be a death sentence. No more. Attitudes are evolving. Case in point, South Africa, where correspondents Caroline Dumais and Stefan Karstens filed this report.
It started 20 years ago with one doctor's room and one NGO. Ndlovu Clinic today specializes in the treatment of HIV and AIDS and receives more than 200 patients a day. People from the community don't hesitate anymore about coming in for treatment. South Africans know that life-saving medication is available. Access to antiretrovirals has revolutionized people's attitude to treatment.
Because first of all, the pills are free, all right? So they don't pay for it. That's one. And 2, they kind of get the best available, the best available, at least compared to the rest of the world.
More than 2.5 million ARVs are distributed every day in South Africa. Treatment is almost entirely financed by the state. As government picks up the tab, donors are progressively withdrawing, and the NGOs are suffering. The founder of this clinic says funding is still needed.
Funders have become AIDS tired, and I think that we can't afford it to neglect this disease in Africa, because if we don't treat it in Africa, it will migrate to Europe where the treatment is available.
South Africa is ironically a victim of its own economic success, and donors are retreating. But providing lifelong treatment for almost 7 million patients is the greatest challenge facing South Africa's health minister.
I haven't had any country saying we've got as much money as we ever needed. So it will always be needed. But all I was saying is we've made sure that our own fiscus in the country finances 80% of the ARV program, so that if donors are still having their own problems, then we are not stranded, or we don't stop the treatment program, it still goes on.
In Ndlovu Clinic, new patients arrive every day. As private funding dries up, NGOs have to partner with government to cope with South Africa's HIV pandemic.
All right, that France 24 report. And one of the ironies, though, is that the ARVs, as they call them, the antiretroviral drugs, have been successful, and so you have more survivors.
Yes.
So there are more people to care for, and that's a cost.
I think it was very interesting because we have to remember a few years back people were telling us that treatment could not be given to poor people. They will not be able to follow the procedures. It's too expensive. It was $15,000 per person per year. We have been able to break this trajectory of the cost, which enable us today to give almost a treatment to 14 million people. But we still have 18 million people waiting for treatment. And what we are seeing, which is very encouraging, is that governments are coming more and more. South Africa is a very good example. A few years back, they were dependent completely to Global Fund and PEPFAR Fund. Today, they are paying almost $2 billion from their own budget. They are putting 2.3 million people on treatment, which is one of the biggest treatment programs in the world.
Aid workers say the government in South Africa has done a good job on treatment. They're now worried, though, that there are fewer awareness campaigns than there used to be.
I fully agree, because all our victory in this fight against HIV/AIDS was the victory of civil society. Let us not forget, with TAC, which was very active in South Africa, was creating a social movement, making the demand for services, pushing all of us, government, to come and to make sure that program could be delivered. Those networks today are unfortunately losing their funding base. And if we are not capable to maintain at least this civil society movement, we will be certainly losing one of the most important.
And perhaps a place where the government has to step in.
Yes,
more.
I think government need to more and more pay, because it is about democratizing society, making sure that people will continue to exist, their voice will be heard. If not, we will lose completely this accountability mechanism, which is critical for the future.
Michel Sidibé, I want to ask you about another part of the world, West Africa.
Yes.
Right now hit by the worst ever Ebola outbreak. We're hearing alarming reports that those who are suffering from AIDS are unable to access their treatment at this point.
Yes, I think I was just in Mali with Jean-François Delfrécy from France, and also Margaret Chan and Global Fund. I can just say that, what we are facing today in those three countries is a little bit what we have been facing with HIV/AIDS. People are scared, so fear, and stigma, discrimination, exclusion, and people are hiding themselves. And also the medical doctors cannot cope. We face one of the major challenges
We're hearing
terms
there's
of
even
public health.
We're hearing there's a knock-on effect for those who can access their HIV treatments.
30% of people drop in, for example, in Liberia. 30% drop on access to treatment because people are scared. People are also completely overwhelmed. In country like Liberia,
They don't want to go to hospital.
No, they don't want to go. And we have been demonizing hospital health structure. We face all of that when you don't have treatment, we don't have a vaccine, you don't have, people are scared and not coming. And people are dying, of course, from Ebola, but people are dying from lack of access to HIV treatment. We are seeing that in different places, dying because they are pregnant and they don't have access to services. A country like Liberia, one doctor for 90,000 people. It's also very important for us to start thinking about how we change completely our global health perspective to reinforce also health care givers and reinforce our health system.
Michel Sidibé, final question for you. We saw the focus in that report on those antiretroviral drugs. When will we get a vaccine?
I think vaccine will be certainly a part of luck we will have in the research. A lot of
research,
yes, because I think I believe more on a functional cure. And I personally believe that we should continue to invest in vaccine. We should push to make sure that researchers will put more effort on that one. But it's a very delicate research base because we have been seeing some progress, of course, with Thai and US, but it's still just 35 or 33% of efficacy.
All right, so still a long ways away.
Long ways.
Michel Sidibé, Executive Director of the UNAIDS organization. Many thanks for being with us.
Thank you very much.
Stay with us. There's more to come. We'll have more news plus the day's business and sports.